Situated at the world's busiest border crossing, San Diego is uniquely positioned to see the spread of illicit drugs. Yet, many are still afflicted by drugs obtained by their doctors. Consider this story. 5 days before she died, a 34-year-old woman went to a City Heights Walgreens and filled a prescription for oxycodone. It was the 54th prescription she had filled in the past year, prescriptions written by 36 different doctors and dispensed by 21 different pharmacies. The more than 1,300 pills she had received in the past 12 months topped the list of addictive and dangerous prescriptions. Opiate painkillers hydrocodone, oxycodone, and codeine, the sleeping agent Ambien, anti-anxiety med lorazepam, and muscle relaxant carisoprodol, better known as Soma. This prescription, 24 pills containing 5 milligrams of oxycodone each, a relatively low dosage, would be her last. On March 11, 2013, she overdosed on the drug. That year, 253 others in San Diego County shared her fate, dying from unintended prescription overdoses, as part of the nation's growing epidemic of pill abuse and use. But why? The question set Dr. Ronit Lev, the head of emergency medicine at Scripps Mercy Hospital, on a mission to find out. She looked to the dead for answers.
So I've been working on the issue of prescription drug deaths for 5 years, and we started the study 5 years ago. After looking at the data, we call it the Death Diaries. When San Diego established the Prescription Drug Abuse Task Force, we got the medical community together, and a common question among physicians was, would people really die if they were taking their medicine as they were told? So we went to the medical examiner's office and looked at 253 people in 2013 who died of a medication overdose by accident. These weren't suicides, no other medical problems. They just took medications and didn't wake up. So we took all information about them and matched it to a cures report, a prescription drug history that Department of Justice has for 12 months before they died, and did the research on why people are dying.
I spoke with reporter Kristina Davis about her time with the Death Diaries. I'm Daniel Wheaton, and this is Refocus. Kristina Davis, you happened upon this doctor who wanted to look deeper into the way that prescription drugs are being abused, and she is writing what they're called the Death Diaries. It sounds dramatic and awful, but something that people really need to pay attention to. So why don't you tell us a little bit about how this story kind of unfolded?
Sure. And you're right. Death Diaries are pretty dramatic and awful. I've been covering drugs as part of my beat for quite a long time. A lot of the illegal drugs, and then obviously lately the prescription drugs, right? Because that's so huge now. And I thought that this study just had a real uniqueness to it, which is why I decided to take an in-depth approach to it. So I met Dr. Ronit Lev a few months ago at the California Opioid Policy Summit. I think that's what it's called. And it was a big gathering of law enforcement, prosecutors, recovery experts, the medical community, all coming together here in San Diego from all over the state for I think it was a one-day event, just to talk about this opioid crisis and putting ideas together, sharing different programs and solutions and things like that to try to get a handle on it. And Dr. Lev was there, so I connected with her after a panel at the summit, and she started telling me about this project that she had. And you're right, yeah, the name Death Diaries is pretty catchy, and kind of went, well, what is that? And yeah, I met with her a few times, and we talked about it, several interviews, and she gave me a lot of data, and that's kind of how the story came about.
So what exactly are the Death Diaries? How is she keeping these records?
So she basically teamed up with the medical examiner's office to look at, she wanted to take a slice in time of prescription overdose deaths in San Diego County. So she looked at the year 2013. So I think she started this in 2014. So she took the previous year, 2013, and got all of the prescription overdose deaths from that year here in the county. And there were, something like 254, I think. I don't have that number right in front of me. And then she wanted to look at the prescription histories of all of these victims and basically figure out, why did these people die? Is there anything that we can learn from these deaths and the drugs that they were taking and the interactions and everything? So then she went to this state database called, it's got some long acronym, but some name, but it's called CURES for short. She looked at that, and that database has been around for a few years now. It keeps getting improved, but basically it forces, by state law, pharmacies to log every time they fill a prescription for somebody, right? So you go to the pharmacy. Every prescription, pretty much, I think. You get your pain medication or your allergy medication or whatever, and the pharmacy just electronically, automatically logs that Kristina Davis got this antibiotic this date, and here's the doctor who signed the prescription. And then doctors are able to, when I go see a doctor, they're able to go into that database and see all of the drugs that have been previously prescribed. Which seems like a really cool, helpful system. So what she did was she took the people who died of overdose deaths in 2013 and then went and checked all of those victims' prescription histories in the year leading up to their death to see what drugs they were on, what doctors were prescribing them, if were there any troubling patterns, that kind of thing. And then she also looked at the toxicology. What drugs did the person have on board when they died? And she got some help crunching all that data. And the result is what she called the death diaries. And she learned a lot of things from that.
So why don't you walk us through, what are the most common drugs that people who die because of prescription overdose tend to have in their systems?
So hydrocodone was the leader of people who had that drug in their system, either just hydrocodone alone or more often mixed with other drugs, right? And that actually tied with oxycodone as well. And those are two drugs that we hear a lot about, right? And they're very frequently prescribed to people as pain medication, from like dental surgery to you break your arm, or people who have chronic pain, like back pain or something like that. So methadone is also very high on the list. And that is used to treat heroin addiction mostly. People can obviously abuse it as well. But I think that's surprising. That's a drug that's actually being dispensed to treat an opioid addiction is very dangerous and killing people. Morphine, super, super high painkiller. Surprisingly enough, Benadryl was in some people's system. And then also there were a lot of anti-anxiety type medications called benzodiazepines. That's kind of the family that they're in. And one of the things she found, and this has been found in other studies, it's not like this is new, but this definitely confirmed that taking those kind of anti-anxiety type medications with an opioid was really deadly. It's a really bad combination, and one that doctors and patients really need to be watching out for. Both kinds of drugs are kind of sedatives, and they can really slow down breathing and some body functions, and can prove really deadly.
So why don't you walk us through kind of a passage, so to speak, in the Death Diary? So what is kind of the common narrative of people who die this way?
I don't know if there's really a common narrative, but there's definitely different patterns that she's seen. And I just kind of talked about one of those, right, is 80% of the people who died had multiple medications and was mixing substances. So for the most part, it wasn't just a single drug that killed somebody.
Yeah.
And those cocktails can also include like meth or alcohol or whatever, right? So that was very, very common. Another thing that she saw a lot of, and it wasn't the majority of patients, but it was still a big theme in the research, was doctor shoppers. And she defined a doctor shopper as a patient who had 4 prescriptions from 4 different doctors and got them filled at 4 different pharmacies over the course of a year. Mm-hmm. And that just means that the patient is just going to whoever they can, basically, to get them their medication, their drugs. And there's one case, and I lead off my story with this case, and it's just so, it's just kind of shocking to look at. Even though we know this happens, it's still just shocking. This woman died of a oxycodone overdose, and you look at her prescription history, and she had gotten prescription drugs, and these are all like really highly addictive, dangerous drugs, from I think 36 different doctors and 21 different pharmacies in 1 year. And it's like, you just look at that and you say, who's looking at this? And the thing that Dr. Lev found is cases like that show that these doctors and pharmacies clearly are not going to that state database and looking at these prescription histories, because you would think any kind of reasonable and smart doctor, which a lot of these doctors are, would take one look at that and say, okay, this woman obviously has a problem. I'm not going to fill this prescription. And unfortunately, these patients will just find some other doctor who will prescribe them. Mm-hmm. So that was definitely something that was really troubling. And like I said, only 28% of the deaths that she came across were doctor shoppers. But those patients had over half, I think, of the prescriptions that were filled during that year. So,
yeah, it does seem like this issue of prescription drug abuse is a bit of a chicken and egg problem, in which obviously the doctors want to help people but don't know what that line is. Are there people that are trying to push more physicians to be aware of the information that's available? Like, what are people trying to do to stem this problem?
Yeah, I mean, and that's really what Dr. Lev's whole point of this whole thing is, right? Is trying to show doctors this is what happens when you're kind of careless or maybe not doing as good a job as you can. And doctors are very busy. They're seeing a lot of different people, and they're seeing patients that they have no prior history with either. But I think Dr. Lev is really hoping that just alerting these doctors and just like giving them a wake-up call will just help their prescribing habits. Mm-hmm. And, you know, a few years ago, the medical community, and when she started this project, you know, they're very defensive about this. And a lot of them say, well, you know, if only the patients were actually following our instructions, they wouldn't be dying. Well, yeah. Right?
Easy thing to say, but...
Okay. But Dr. Lev felt that the medical community really needs to stand up and take some kind of responsibility also, and take some role in this and trying to curb this crisis. Now, you're right. They can't, you know, control what everyone's doing at home and everything. And these things are going to still happen. But if doctors were maybe just given some tools, and they do have some tools, and using them the way that they should, maybe they would just be seeing more red flags, be able to intervene more, and maybe that they really would curb that. Now, I had some interesting discussions with some other doctors that I spoke with, and this didn't really end up in my story, but they were saying this issue is so much at the forefront of a lot of doctors' minds right now that it's actually causing a lot of doctors, they don't even want to prescribe some of this medication because they feel like they don't want to be liable. They're just kind of so scared of the ramifications. It's almost having like a chilling effect. Exactly. Which that's not good either, because there are obviously people in chronic pain, and I'm not a doctor. I don't know the answer to that. Mm-hmm. It must be terrible to be in constant pain all the time. Mm-hmm. Right. So it's very interesting. Part of the study that I think is really unique, like I said, there have been other studies about this kind of stuff, right? Dr. Lev thought it would just be really good if doctors knew when their patients died, because there's really no reporting mechanism for like that, right? Someone rolls into the emergency room with a broken leg, you prescribe them 15 pain pills or whatever, and then 6 months later, the person dies of an overdose. That ER doctor is not going to know. Those drugs may or may not have been the drugs that they took that killed them. But Dr. Lev just thought it was important for doctors to know. So part of her study is she sent letters to some of those doctors notifying them that a patient of yours who you had given a prescription to in the past 10 months and who has died of an overdose, has died. And we're not blaming you for the death. We're not saying your drugs killed this person, but we just thought you should know. Mm-hmm. And then she directs them to this website and tools on how to just maybe look to see, check the patient history and everything like that. And part of the experiment is she sent about 400 letters out to doctors notifying them of the death, and then she did not send letters to another 400 doctors. Mm-hmm. And so now what she's trying to see is the doctors who did get the letters, has that been a wake-up call, or have they changed their prescribing habits? So we're still waiting. That part of the research is probably a couple months away from being finalized, and hopefully we'll get the results of that and see if just by a doctor knowing that, and if they might be more careful.
Mm-hmm. And also, as someone who's been covering illicit drug use, legal and illegal in San Diego, what are some of the trends that you've been seeing over the past couple of years? Is anything changing when it comes to what people are dying of and why?
Like all over the country, I mean, the opioid crisis is definitely here. The opioid-related deaths just keep going up, up, up. I don't, unfortunately, have that exact number on hand right now, but I've seen the charts, and it just goes up, right? Mm-hmm. So that's clearly something that needs to be addressed along with the whole country, and the same with meth. A lot of people kind of think as meth in San Diego is like in the 90s, like the biker gangs controlled the meth, a lot of the meth pipelines, and people were cooking it in their houses and meth labs blowing up. And we've really gotten a handle on all of that since then. But what happened is all of the meth is pretty much being cooked down in these huge super labs in Mexico and being smuggled up through the border by the cartels. And the meth problem has not gone away, and it's getting worse. And the meth deaths also just continue to rise. Mm-hmm. And the authorities here in San Diego who kind of are working to help and stem these problems, I think they're a little frustrated that maybe that message just isn't quite getting out there. I think a lot of the messaging right now is around opioids and fentanyl. We can talk about fentanyl too. And they think that there's maybe people are kind of tired of hearing of meth. It's kind of like, oh no, we did that already.
Yeah, it's strange how we get tired of hearing something that's so important. It's like buckle up kind of thing when it's still important.
Right. And then fentanyl, that's a synthetic opioid that is also coming from the labs down in Mexico here, and the majority of Mexico fentanyl is coming in through San Diego ports of entry, and it's going all over the country, and it's killing people all over the country, much more in some places, more on the East Coast for whatever reason. San Diego, we haven't had as many, although it's definitely an issue. And fentanyl they say it can be 50 times stronger than heroin, and a lot of the deaths are happening when basically fentanyl it's very potent in very small amounts, and it gets mixed into a batch of other kinds of drugs or counterfeit oxycodone pills that are sold on the street. And if someone doesn't mix that batch right and you get like a hot spot, you're dead. So, I mean, I've read some DEA intelligence that talks about the cartels wanting to make sure that they're not sending out bad fentanyl and these hot spots, and that they're mixing it properly because they don't want to kill off their clientele. of course. And I think they're seeing some of these really bad batches more in the home kitchen type things, because it's very easy to make yourself. The other way people are getting it is through the dark web, and you can even get it on the regular internet too. You can order it from China, and it's just a small amount, and is all you need for a ton of doses to mix into tablets or whatever. So you can just get from China a pretty small little package in the mail and delivered to your house through the parcel service. And you've got a lot of money on your hands. It's very lucrative. And the Postal Service is definitely trying to crack down on that angle. And I just saw, too, today that China has just put in some regulations against some of the precursor chemicals of that make fentanyl, because it was easy to obtain those precursor chemicals as well from China, and then just do some chemistry here, pretty easy in your kitchen, and make fentanyl.
Kristina Davis, thank you so much.
Thank you.
Refocus is a production of the San Diego Union-Tribune. This episode was produced by myself, Lauren Flynn, and Laura Hockule. To stay up to date on San Diego news, follow us on social media and check out our site. If you're still listening, please subscribe wherever you get your podcasts and rate and review us. For the San Diego Union-Tribune, I'm Daniel Wheaton.